Good afternoon, ladies and gentlemen. My name is Brian Gilpatrick. This is my better half, Kasha. Okay, here's kind of our quick short agenda for this. We're going to spend a little bit of time talking about what post-traumatic growth is, and that's what post-traumatic growth is as defined by Drs. Tedishi and Calhoun. Since it's a relatively new field of study, there's multiple definitions out there as to exactly what it is. There's multiple ways for it to be thought about. We focused our presentation primarily on those two individuals because they're the ones who kind of founded it, or at least coined the term for it, created the first book around it, and have done probably the bulk of the research on it.
I can maybe send it around. Jennifer, it's not book because it was used a lot, but.
And then after that piece, we're going to talk about the clinical implications. And this is the part where we tell you all before, we can kind of modify this based on clinician or not kind of deal. We'll follow, part of that will be an actual case presentation, which is where her and I will talk out a case of somebody who's actually going through the different pieces of post-traumatic growth. And then once we talk about to give you an idea of what it says, Kasha will then take it from there and talk about the different aspects of that mock session that highlight post-traumatic growth. This is the formal definition of what post-traumatic growth is, which is a construct of positive psychological change that occurs as a result of one's struggle with highly challenging, stressful, and traumatic events. Basically what it means is that they found that a person can grow as a result of a traumatic event. Now, how many people in here always have heard that if you go through a traumatic event, either you're going to be one of the lucky people who has resilience, and you'll just be okay with it, or you're one of the other people who's going to end up with PTSD and all those negative implications that people always talk about with PTSD. And that's kind of how most people always perceive traumatic event, bad things happen to me. For the right or the wrong, it seems to be a lot of the perception within communities. But these guys have come out with is the fact that they're saying that, well, you know what? For some people out there, there's resilience where traumatic events don't bother them, or certain traumatic events don't bother them, so they're okay with it. There's other individuals that the traumatic event so changes their perception of the world that they develop PTSD from it, or signs of PTSD from it. Well, these guys have come along and said, well, we've found another group of people out there. Those people that experience a traumatic event, they're not experiencing resilience, so they're not just toughing through it. They're actually growing from it. They've taken this horrible event and they've had growth from it. And so that's what kind of got these guys really into investigating and see, wow, that's kind of interesting. Why is that? Why do two people who experience the same event, one has PTSD, one grows from it? One gets the brighter side of light, the other one deals with nightmares and all the other kind of characteristics that come along. The first part about this that I want to talk about too is about resilience and PTG. Generally, whenever we discuss post-traumatic growth and the characteristics of it, the first thing we get back from usually clinicians is, oh, this is just resilience. This is just a person who's able to handle it. And that's not the case. As a definition, resilience is the individual's capacity to withstand the stressors and to not manifest problems from it, formerly psychological dysfunction, but not to manifest any problems from it. So they withstand it. They're able to fight against it. Just for reasons that we don't 100% know, it doesn't affect them. PTG is the complete opposite of that. Like I said just a little bit ago, PTG is people who grow. They experience positive life changes as a result of the traumatic event. So they don't just withstand it. It doesn't have zero effect on them. It has an effect, a positive effect on them. And a lot of the research now looking out there is trying to determine what is it about those individuals. What is it if I take these two individuals, expose them to the same event, does this guy get growth from it? What's different from it? Outwardly, they might all be the same, same basic characteristics, same basic, growing up and all that kind of stuff, but there's something else deeper that they haven't quite laid their finger on to figure out why this is. There's some ideas, but nothing 100% definitive yet. Everybody still with me? All good? Okay. There's three major, what they call domains. There are three major domains of PTG, and this is the existential spiritual self. So religion, basically. Religion and spirituality is kind of what we're talking about there. Relationships with others, and then your relationship with yourself. Okay? We'll talk about each one of these a little bit more. So what they're basically saying with this piece is that, so for those people that experience growth, they tend to experience growth in one or more of these areas. And they've been able to kind of categorize those. Okay. For the existential spiritual, or religion spiritual side of the house, they found that people end up with a greater appreciation of life itself. They start to enjoy life more. They start to find things that before that they didn't think were so great, and they start to just almost like more of a vibrant feeling of life has come to them, which is really a positive thing. They change their priorities in life. They found people who might have had, their priority might have been just work. This is, I got to make money and work. Experience a traumatic event and then decide, you know what, that's really not that important to me in life anymore. Maybe being with my family is much more important. Maybe traveling, things of that nature that that they never thought about before start to become more of a priority to them because of the experience they had. And then they get a change of view of the world, generally for the more positive. They start to see some of the good, an individual who before might have seen only the negative in the world and all the horrible that we see on the news. Some of these people develop a new look at the world, and they see the beauty and the wonder and the greatness in the world. And they start to get a really deep feeling of all those kind of things, not just superficial. For the people that go through the growth, it's a very deep feeling that they go through. They found they start to discover new perspectives about their relationship, new things that they might have taken for granted. You ever hear that thing, the wife tells the husband, you always take me for granted? Well, they started to find that people who go through who go through the trauma, have PTG, start to recognize those kind of things and start to appreciate them more and start to realize, wow, these things are really important. These things are actually more important than I thought they were. And they start to become more attentive, more attuned to their relationship and start looking for more things within their relationship, deeper things in their relationship, where before maybe they were an individual that only had lots of superficial relationships. They now look for the deeper, the love and those kind of things more deep in their relationship. And then just an overall increased appreciation for the significant others. That one kind of makes a lot more sense. You go through a traumatic event and you realize, I really do love you. And I really do love the kids and that kind of stuff. But it even goes beyond that. It goes to where people who might have, always loved the wife and kids, they start to realize, wow, you know what? The cousins I don't talk to very often, the grandparents I don't really go see very often, they mean so much more to me now. I see so much more of the worth in them, so much more of the worth in the time spending with them. And so they start to not only, solidify their relationships with like spouses and children, but then they start to reach out maybe towards the larger family and look for a relationship with them and start to build relationships that way. Maybe with friends they hadn't talked to in years, they start to go back and look for. So they start doing all these what we consider much more positive kind of things, especially when you consider the alternate for a lot of people, PTSD. So. And then for self, they get an increased sense of their own personal self, their own personal strengths. They start to realize, wow, I've gone through that traumatic event. I'm a much more stronger person than I ever thought I was. I could accomplish more than I ever, maybe I ever thought I did. So they start to look at that and see with themselves, what can I really do with myself? Where can I really go? And they start taking that deeper look at them. And then the other one, which is, I don't think it would be probably too much of a shock for somebody who survives a trauma, they start appreciating the smaller things in life. The person who used to speed on by the local park every day, never paid attention to it, might actually finally decide, I'm going to stop there and take a walk around and see what's in nature. Start to enjoy those kind of little things in life that I just kind of ignored.
But they feel connected with basically there was a research, basically they asked people that went to therapy for the growth, and a lot of them said that they felt connected to universe, connected, that they feel one with the nature. They went to the forest for a walk. They felt connected with even animals, that we are one basically. Everything is one in the universe, so that they are appreciating things like that.
Yes, yeah. It's definitely overall much more appreciation for who you are, who you have in your world and your environment, and for the world and the environment itself. We're going to get ready at this point, kind of transition over to the clinical piece. But I want to stop real quick and check to make sure everybody kind of following. Is it making sense to everybody? Kind of deal. Is everything okay? You're good. Okay. All right. For all, no questions from them. They're good. Okay, so we're going at this point I'm going to kind of turn it over to my better half here.
Well, we're going to.
Yeah, we'll be doing that. We'll be doing jointly, but she's running this
part. So Brian talked about like what PTG is, basically like a model of it. What I'm trying to focus, to concentrate on, is what PTG looks in therapy. It's first of all, it's not. A lot of people think that post-traumatic growth is a new modality. Like you folks, like I'm sure you knowledgeable that there are different kinds of modalities in therapy: behavioral, cognitive behavioral, humanistic. So every therapist we go to, they have different school of thought, and they do therapy based on that. PTG can actually be combined with any of them. It's not a new thing that therapists need to go and be trained in a new modality. It is something that they can combine with their own school. Even though they did a little bit research on that, and they found out that the best it works with cognitive therapy, narrative therapy, and existential approaches. So I don't know if you have any questions of these. I don't know if you know these kinds of therapies. If you ever.
I don't understand the word cognitive. I can't. I've heard it so many times in the hospital, but I'm not quite sure. Is that the movements, talking, moving, using your fingers, or is it the understanding of
it's usually they'll look at your thought process.
Okay.
Whether they believe that sometimes people may have irrational thoughts. They kind of overgeneralizing things. Like for example, somebody may hear something not nice from the other person, and instead of thinking, oh well, it happens, maybe that person has a bad day, so they took it on me, they'll go home and like, oh my gosh, everybody hates me, I'm bad, I will fail in everything. So that's kind of overgeneralizing bad things in life. So cognitive therapy is trying to teach you how to basically correct your thinking, to not to take everything personally, be able to stand a little bit, kind of take a step back.
Yeah. Basically, yeah.
And not to worry about
kind of sit and look out and and try to figure out why you take, like she said in that example, why you take somebody making a comment and make it into maybe something that bothers you all night long or bothers you for weeks. So they take a look at that, why is that kind of going on with you, and then they work with you to try to figure out how can we change that, how can you modify the way you're kind of thinking there to to something that's more, that allows you to be more functional, so that every time you hear somebody say something about you, you don't spend the next week worried about it, kind of deal. So that's what kind of the cognitive.
Roaming in the negative way.
Yeah,
exactly. So you can't stop your brain.
And that's what they kind of try to do, is figure it out and figure out why it is and how you can help it, how you can work with it.
Yeah.
So then the narrative is the one-on-one talking?
Yeah. It's looking usually for, the therapist will listen to history of your life and find they'll be looking for strengths, they'll be looking for the less positive things in your life, and they will help you combine it in one story, and they'll help you kind of like retell your story, change your story a little bit for you to see yourself from a more positive light, positive angle. Yeah.
Yeah, because a lot of times for most people, and they tend to always look at the bad things in their life. We tend to, as humans in general, we tend to look at the bad things in life. We tend to focus on those kind of bad things, and that kind of what becomes the driving force in our life, kind of deal. and what, like Kasha said, what they're doing with the narrative is they're actually taking you back. They're looking at, the positive things that have occurred in life, maybe the less positive things that occur in life, and then working with you to, like she was just saying, recreate that story to say, hey, look, everything in your life has not been necessarily bad. Here's the good things. Yeah, here's some not so good things. But here's how we can combine it all together and tell the life story so that in the end you come out with the more positive in your life story. You realize that there is that positive in my life story, that it hasn't all been negative for the last 40 years kind of deal.
And they'll also listen to the language clients use, and if they use, a lot of people will use very negative comments about themselves. So narrative therapy will focus, they'll concentrate on these negative symbols and themes the clients say all the time, and they'll slowly try to change them into more positive, affirmative statements. And narrative therapy also use a lot of book reading, doing exercises, kind of self-reflective exercises, that kind of stuff. And existential approaches is basically meaningful. It's a kind of a deeper form of therapy that you're looking for what is meaningful overall in your life. Looking for what are you anxious about in life. And usually their goal is for a client to accept it, that we're all going to die, but how to manage our life to that point without unnecessary stress, going in circles, running in circles, looking for a best solution, sometimes accepting that our life is mortal, we'll face illness, suffering. Sometimes it is.
On the Frankl book is.
The Frankl,
the Viktor Frankl book we gave you about, is basically an existential thing. That's kind of what he discusses in there. He looks at, like we were saying, he looks at the facts of, the horrible things he did that occurred to him in Auschwitz, and how he kind of just worked with that and reformed it into what she was saying. So that book is kind of a beginning to end kind of look at the concept she just was telling you about.
Yeah, so, the difference between these cognitive narrative and existential approaches to therapists that is using a PTG model in therapy is that a lot of therapists, I don't know your experiences, but a lot of therapists will lead a client in therapy. Usually, sometimes some of them are directive. They'll tell you what to do. We're doing this homework, that homework. But sometimes they will do more talking than a client in therapy. PTG therapists are usually the ones that listen to your story, follow you closely. They will not tell you, okay, now we're talking about your trauma. They will sit and wait what you want to talk about. And they are not even called clinicians, they're not even called therapists in this model, they are called expert companions. So their role is to be your companion, always be 2 steps behind you and follow your lead. So that's their most important task. Also, these therapists are not afraid to be, and again, I don't know your experience with therapists, but some therapists will shy away when client starts crying or showing very emotional states. They'll kind of shy away from it. These therapists will be painfully sitting there with you, waiting till you decide to feel better during the session. And they also are not afraid to be changed by your experience. They don't see clients as just symptoms coming into their session that they need to fix. you're a human being that went through traumatic event, and they're there to listen and learn something from you and guide you to growth. That's their basically the task.
So the clinician follows a certain course to become that person, to become that expert companion, or that's more of a natural process?
It's more natural process. There's no like formal training, formal schooling for that.
So some just do that naturally and some don't?
Yes, some clinicians may read about PTG model and say, you know what, it's kind of neat, I want to do that. But it's not that you have to go somewhere and finish a course or a class to be certified PTG therapist. That's something. It's the way a way of dealing with the client. The way that the therapists are ready to be more patient, more trustful. Because another thing is that they trust clients. They know where clients are going, and they're just following them. So these are the most.
And just yeah, well, I just want to add, yeah. So yeah, there is no formal education like you might have with certain other types of therapies kind of deal. For those who want to do this, there's books, there's hand guides, there's manuals, there's things of that nature that they can use to help them learn these kind of different things they need to do and all that. But there is no like formal, like you said, there's no formal structured course yet that has to be taken. So it's up to the clinician who finds that, you know what, this is kind of how I do therapy anyway, or this is something I'm interested in doing, and then it's up to them to do their own studying, their own research, and their own work to kind of find those characteristics and start to develop them in themselves to do this.
Mm-hmm.
Of course, they would behoove them with supervision of somebody else who's already doing it. Would of course help them as a clinician.
I just wonder how the client or the patient would recognize that, whether they're in the right fit with someone.
We'll have actually a few model elements that clinicians follow. So maybe that will give you some clues. If not, we can even talk more about it.
Yeah, and I just want to make sure I'm understanding. You're saying, so how does a clinician kind of know if they're right for this kind of?
How do I know they're right for me?
As a client.
Right.
For PTD specifically, or overall as a general question?
I've probably experienced at least 2 or 3 different types of therapists.
Right.
And at least 1 or 2 of them probably fall along that line.
Okay.
I've come across 1 or 2 others that don't.
Mm-hmm.
And I only know that after the fact, or in the middle of it.
And the only, I guess, suggestion I can give you on that, and it's only suggestion, it's not going to be 100% kind of solution to it, is when you first go in for that first session where they're asking you all those kind of questions and they've got your biopsychosocial history and they're asking all those kind of things, you've got the opportunity there to ask them. So if you think characteristics like this are kind of what you're looking for in a therapist, you want a therapist who's going to be, kind of my companion, who's not going to tell me what to do, who's going to guide me, you can ask that question. Ask them, how do you do this? This is what kind of therapy, this kind of a therapist I'm looking for. This is the ones I felt comfortable with. These are the ones I've had the most success with. And be upfront with that, and ask them that and see what they say. No clinician you see should have any issue explaining to you their background, where they come from, and how they conduct therapy. They should not have any problem at all. Say, no, you know what, that's actually not the way I do it. Here's how I tend to conduct therapy, here's what I look at doing, and here's why I think this is the best approach, kind of deal. And then it'll be up to you at that point to decide, well, you know what, this is what I wanted, this is what they say they do, and that kind of matches, or no, you're not anywhere near kind of what I'm looking for, and request to see, you can try to request to see somebody else. I mean, it's always a right of a patient to, and a lot of people think, and this kind of is a little bit off this thing of what we're talking about, but a lot of people think that you go see a therapist, they're going to be able to help you. The biggest part of therapy is the relationship between the therapist and the client, kind of deal. That's the biggest piece. And it's not unusual. I've seen it. There's not unusual for patients to see 2, 3 clinicians before they find the one that is the right fit for them. And it's just, but that's the key. If you're in that session and you don't have that fit between you and the therapist, therapy is not going to be as productive as it is if you've got that person that you can work with. I'm sure you probably experienced that. If you've got a couple that you've had that you like kind of, and so that's the key. And a lot of people don't think. They think, I go to a therapist, they're all the same. They all do the same thing. No, even 2 therapists that went through the exact same program who are both maybe cognitive behavioral therapists, they can be 2 completely different people in the therapy session. They have the same basic of knowledge, the same basic way of handling therapy, but themselves and their actual execution of it could be slightly different. And those slight differences could work for you as a client and help you to feel comfortable and help you to open up and help you to talk and do all the things. Or it could be just the opposite. It could be something that might turn you off. And if it does, in essence, you're wasting your time as a client. You're wasting your money because you're paying something to go see them. And in a way, if nothing's coming out of it, it wastes the therapist's time. If you're not getting anything out of it, if you really don't like it, you're not getting anywhere, they're not helping you, so it's not really, it's not good for them either kind of deal. It's best for you to have somebody who can help you.
Yeah, but when you're in the middle of something and you need to go talk to somebody, you're not really thinking, you're not shopping for tires. You're not looking down this stuff. Who's going
Absolutely.
You're going to go to somebody and, it may or may not register right away. This is not who I should be talking to.
Sure, and if it's a situation where you need to see somebody, you need to see somebody. But when you get into the session, even if you're into it several sessions, and that's when you kind of, things may have settled down a little for you, and you realize that maybe this isn't working for me, you can always request. It's the right of any patient to request to see somebody else. So maybe it takes you 4 or 5 sessions, 2, whatever, before you realize, this isn't a fit for me. I'm not getting out of this what I need to get out of this kind of deal. It's your right as a patient to say, you know what, doctor, I like you seem like a nice person, but I'm not, and talk to them about it.
But that's, I understand what you're saying, and that's kind of standing back a little bit. When you're, like I said, when you're in the middle of it, it can be a little bit intimidating.
Absolutely.
So, I don't know, if there's some kind of check-in guideline for the therapist to say, how do you feel about how this has been going, or something like that. I think that would have been helpful to me a long, long time ago.
Or what you always do to kind of help start the conversation is it just because most clinicians will check in with you and just make sure, and they should be watching how things are going along. They should be able to start picking up whether or not you're progressing, or whether or not things aren't progressing for you. And if they don't feel it's progressing, they should bring up that topic to you. But you can also bring up the topic to them in session and say, can we sit down and talk for a little bit? I don't think I'm getting at what I need. And then there are some of us who take responsibility for it not going very well, and it must be something I'm doing wrong, and I'm not listening right, or I'm not thinking about things properly. But see, you're bringing up a perfect thing. That's why if you bring it up to them, you guys can discuss it, and your perception may not be the same perception your therapist has. And then maybe, I've had it where with clients where they think, nothing's going anywhere kind of deal. And then you sit back and you look at the notes from 3 weeks or 4 weeks back and you say, hey, look, here's where you were 4 weeks ago. Here's where you are today. Look at the changes you have made. And sometimes clients need that because you live with yourself every day, 24 hours a day, 7 days a week. You might not necessarily notice
Don't deny me.
No, but to say you might not notice, because none of us do. We don't notice those small changes that may be happening with us.
Right.
So if you feel it might be a good thing to bring up to the therapist and see, and he might be able to go back, or she may be able to go back and show you, hey, look, here's how far you actually have progressed. We have made a lot of progress towards your treatment goals, which might help you to be like, wow, we really did go farther than I thought I did. I really did do a lot of good work. I really am getting towards those goals we've established.
Well, and actually it does. Just since we started sitting here and looking down, you know what? That does sound familiar. Wow, that is what's been happening.
And see, now if you do that with your actual therapist, they're going to have much more detailed notes on everything you guys have been doing, and they'll be able to really kind of show you. And I've had to, with patients, go back and show them and say, look, no, you have come a long way. You might not think it, you may not notice it yet, it may not have sunk into you that you have, but yeah, here, and when people see it and you explain it to them, a lot of times like a little light bulb goes off, like, oh wow, yeah, this is going good. So, and then again, that's something you can easily bring up with your therapist, and they shouldn't have any issue with kind of going back over how things have been going and reevaluating everything and make sure that the fit is still good and you still are going the way you need to achieve those treatment goals and the timelines you guys have kind of established. Does that kind of answer?
Mm-hmm.
And I need to.
No. Thank you.
Okay.
We mentioned a little bit about the clinician characteristics, but there are also, again, based on research, they found out that certain people are more prone to grow from traumatic event than others. And one of the things is that they found that people who were more open to novel things in life, they were ready to take difficult decisions, discuss their deeper feelings with others, were open to different experiences, usually do a little bit better in therapy with trauma-focused therapy, with PTG elements. And usually and we put it on a slider as an assessment for a clinician, but even you as clients, you may ask yourselves, how have I been dealing with problems in my life prior to trauma, and how can I compare it to how am I dealing with problems after the trauma? That usually helps you and the clinician to see if there's a characteristic there that kind of help the growth occur in therapy. Another element of PTG therapy is that obviously we have Vishen Kakun and other researchers call it seismic event, but that's trauma, traumatic event that happens. And obviously we all know that the trauma is usually not a nice thing. It shakes us to the core of our identity, to our core. And what's the difference between PTG model and PTSD focused treatments? If you have a therapist that is focusing on PTSD, they will spend a lot of time talking about trauma itself. What happened, when it happened, how did you feel? It will be just, majority of time will be discussed the event itself. PTG therapists will try to redirect you to talking about what is happening after the trauma. How are you dealing with life? Where are you looking for your strengths? So that's the biggest difference, that they will not try to keep you in that traumatic moment all the time. There are some examples of types of trauma that a client needs to talk more about it. Once I read a story about the parents that had a car accident and their child was killed in that accident. So obviously in cases like that, discussing the trauma, discussing their guilt is very important for them to move on. But in other cases, work trauma, regular car accidents, cancer treatment, we want to focus on what's happening after, not retelling the event over and over again. And again, the therapist that is following this model will definitely listen to you. He will spend or she will spend a lot of time listening to what you're talking about, what you're focusing on, and they will also try to figure out. They'll ask you what strengths you had before the trauma, what strengths you had during the event, how you dealt with the event, and what we can incorporate into your life after the trauma. So, and how to incorporate them and basically redirect your life so you're not focused on trauma all the time. Because what happens with people that have traumatic events with two things here, rumination and cognitive processing. What would you guys differentiate these two things? What's the difference between rumination and cognitive processing?
What is rumination?
Rumination is kind of like when you're basically stuck on a traumatic event.
Mm-hmm.
All you can think is basically reliving the traumatic event. For example, somebody had a car accident. All they can think about is about that day when it happened, the pain they went through, their treatment. They see it over and over again, and they're not able to move on beyond that. So that's a very negative process. That ruminate about negative cognitive process, or some researchers call it reflection rumination. We still think about the event, we still remember it, but there's something in our heads that is telling us, okay, that's enough. I cannot think about it all the time. It's time to move on. What can I do to think about our future and how to grow from it? So that's the biggest difference between rumination and cognitive processing.
If you've gone through whatever the traumatic experience is, the brooding rumination, reliving it, rethinking it all the time, it's always on the front of your mind. Over a period of time, though, that tends to fade into the background, but it's still there.
Exactly.
So where does that fit in that line?
Basically, that even if it fades somewhere in the background, it will affect your thoughts, behaviors,
right.
Even unconsciously.
Right.
You will be more, I will even risk the statement that you'll have more negative attitudes towards everything else. Everything will look gray, black. You won't expect great things from life, because even though you won't actively think about it, it will be slowly working in your unconsciousness. Because you won't just move on beyond that.
Right.
And while cognitive processing, reflection, rumination, you want to keep it up front in your cognitive part of the brain, and not afraid to think about it. So that's what people, I think, make the mistake, that they hope that, okay, a month after my accident or death of my beloved one, I'll just slowly forget about it. And they don't have time to sit down, think about it, and process it and find a closure, which is so important. Because when you find the closure, you are able to move on and find some maybe positive things you can do with what happened. Find the strength to grow. Does it make sense?
Mm-hmm.
So yeah, we don't want to the bad event go behind your curtains. You don't want just to forget about it, because it's still there, like you said.
Right.
And actually, and again, going back to therapists, the therapist that is following that model will again, the biggest thing that will create safe environment for you. They'll encourage you to disclose. They will not be afraid for you to even cry in therapy, discussing the event and your pain, your distress. They'll sit with you and they'll listen. This is the case of a mother that is coming to therapy because she lost her daughter. And her biggest issue is that she keeps thinking about her daughter basically being dead, and she just cannot focus on anything else. Her being a mother is still, she's questioning herself, how can I be a mother to a dead daughter? So the therapist here is trying to move her on beyond that thinking to look for something more positive in her life.
So I'll start again. I guess these thoughts aren't very useful to you or to her.
No, it's not helping anyone.
Maybe when you find yourself thinking such things, you can consider what you're thinking like this, why you're thinking like this, and what it means for your relationship with Julie now.
I'm not sure what you mean.
Like I was saying before, when you're thinking about Julie being cold, you could think that it's because you are her mother or protector. Instead of just thinking she's cold, think about how it actually makes sense that you think this.
You won't feel so crazy.
Right. Also, you might give some thought to your mother-daughter relationship now.
That I'm still her mother.
How does that feel?
Okay, I hate to think that I'm not a mother anymore.
That's another thought that disturbs you.
Yes, I think that a lot.
So you can think about that differently. You're always a mother. I remember that back in World War II when servicemen died, their mothers were called Gold Star mothers. They were still mothers, you see.
Right, so am I.
Yes, you can think about how to be a mother now.
How to be a mother to a dead child?
Does that make sense?
Well, I start thinking about the pictures I have, collecting them together.
See, now you start thinking about something to do. That's better than just going over and over in your mind, she's cold, I can't protect her anymore, I'm not a mother anymore, and thoughts like that.
You know how some people make scholarships and things like that in honor of a loved one? I was just thinking that I wonder if I could do that. It would take some money, but I have some from the insurance, and I have hated that money in a way. I don't want or like it. It's like blood money or something. I know that sounds weird, but I wonder if I could do something for her.
That sounds like something we're thinking about.
I have no idea about any of that stuff, how it works.
Most of us never have to think about such things.
Yeah, I'm one of the lucky ones. I get to have scholarship named after my daughter.
Even the good things connected with her are going to be painful now.
The pain is always there.
But some thoughts just emphasize the pain, like she's cold and I'm not her mother. Other ways of thinking may ease it a little, like about the photos or the scholarship.
It is like a combination of pain and something sweet.
Like the term bittersweet.
I just keep thinking that she's dead and that she's in the cold ground out there and she's cold. When it snowed last week, it really upset me. You must think I'm crazy.
Actually, I don't.
Well, I wonder about me. I know those are crazy things to think, but that's how I feel.
You're always her mother. You always try to protect her. You can't expect to stop thinking that way right now.
But I better stop. It's like I can't think of anything else, and I can't protect her anymore.
What is there to protect her from? The cold?
It doesn't make sense, does it?
Exactly. Bittersweet is maybe the best I'm ever going to get.
Maybe so.
But I don't want to be just bitter. Sorry, maybe so. Sorry.
But I don't want to be just bitter.
I hope not.
So I'm trying to get more to the bittersweet.
And you have some choice in that, like you're thinking. I can't see how you can't think of her.
oh no, I wouldn't want you not to think of her.
And you can't not think of her anyway. You're her mother after all.
Yeah.
But maybe you could think of that in a more useful, bittersweet way, more purely painful, bitter way.
Did you guys notice anything? How the session went? What was the role of therapist? What was the role of the client? Any new things for you from your experience with therapy or something similar that was going on for you?
How do you mean?
Like, if there's anything that you noticed that therapist did that could be helpful to a client.
It kind of just seemed like you were having a conversation with your friend.
Mm-hmm. Exactly. Exactly. And also, don't know if you pay attention to the part when she talks about the scholarship. A lot of therapists would jump and say, oh, you know what, I can give you the address of the guy that I know. They can help you set it up. He didn't do it. The therapists in PTG model, they don't want quick fixes because doesn't work. She will go home and like, okay, I have a great solution. And then the next day she was like, does it really make sense? He let her get to that point by her own work, by her own cognitive process. You know, he just said, you know what? Most of us don't think about this. Most of us don't think about our dead children laying in the ground cold. So he let her come up with the idea and follow through this. So that was kind of a different what PTG therapists would do for their clients. They would not give them ready solutions. So that narrative is basically is connecting to what we already said, listening, and listening about what kind of a person a client was before trauma, after trauma, enduring trauma. And like Brian mentioned, that sometimes a therapist can point out something that the client is not thinking about. That, hey, you said that you were able to deal with these problems this way before this horrible thing happened, but you are still able to do it.
Well, it was actually in the case we just read where she wasn't thinking of herself as a mom anymore. And the therapist, or remember, in PTG, it's the expert companion, reminded her, no, you're still a mom. You're always going to be a mom. You know, it was something that she had forgotten, something she just hadn't thought about for a while. And he was able to bring that back around to her and remind her of that again. And you could see, as in the case, it really made a big difference to her being reminded, yeah, I am still a mom.
Yeah. Oh, exactly. And now kind of like a final thing about PTG. The PTG, the growth after trauma, is not per se a goal in therapy, because like we talked about the characteristics of the clinician, they're not there to put a string around your neck and pull you towards the growth, because it depends on the person who comes to therapy, whether they're ready to grow or not. And also it's important to know that even if people are growing, they may still have bad days. The beauty of trauma is that it will come back in dreams. You'll think about it sometimes, and it will make you feel bad. But it doesn't mean that it stops you from growing. It's a kind of a very a tricky process, a long process to grow from it. But the end goal of if growth happens, a client hopefully will achieve wisdom. And we have a definition of wisdom that basically fits PTG. model. Basically, if we think about wisdom as an ability to synthesize and balance paradoxical information, order and chaos, and complexity of life, we see that PTG brings such effect. Its ability to basically accept that we have bad days, we have good days, but there's nothing we can do about it. Acceptance and rolling with it is the best way to deal with the life. And so instead of getting mad or disappointed that, oh, my therapist told me I'll feel better, but I'm not, that means I'm not growing, that may not be a good way to think. The consciousness that bad days will happen is also wisdom. That life is unpredictable. And if we have bad days, yes, it's normal. But it doesn't mean that I won't be able to grow from it. Because even it's kind of a truism, but we can grow from even small bad things that can happen in our daily lives.
I'll finish. And this is our last slide. And basically, what we want to just show here real quick is that since PTG is still relatively new, it's only been out around like 14 years or so. It hasn't been checked or verified that it's possible in all different types of trauma and all that. Four that they have done research on have proved that people do grow from these kind of traumas has been cancer, bereavement. They've shown post-traumatic growth after war for combat veterans, and then post-traumatic growth in children. So these are kind of the areas where some research has been done, and they've had some validity to say, yeah, you know what, we can say that people have grown after experiencing these kind of events.
And also the new field that is emerging is people with childhood trauma, because it's very hard to point, like with all these with all these examples, we can exactly point out when the trauma happened. Diagnosis of cancer, death of beloved one, a war, or it's usually losing their parents or being diagnosed with cancer or things like that. People with, for example, that they were abused in childhood, they don't have this comparison because they don't know who they are before trauma, because there was no before. So what can be done with them in therapy is to basically talk about them imagining what kind of a person they would be if not trauma, and also pointing that there is still strength. There was my colleague in New Jersey was working with a lady that was abused since she was, oh my God, 3 years old. She was sexually abused by her father, stepfather, and uncles. And so there was not really a beginning of trauma for her. But in therapy, she was able to learn to actually, the therapist point out, and she kind of went with it. She was a huge animal lover, and she ran the shelter for homeless cats and dogs. So because her idea of being abused in childhood was, I'm a bad person because I allowed this to happen, even though I was 5, but I let them abuse me. So she felt morally guilty and rotten inside. But then the therapist slowly started asking her about her relationship with animals. She said, you're right, I care for them. I'm ready to sacrifice my life to have a shelter and do everything I can for their lives to be better. So we can still see that people with ongoing trauma, where there is no beginning, no end, no middle, still are being able to grow. But they are harder to point that that process for them, and it takes more time for them to see that they can be good people, even though they went through horrible, horrible things.